My husband tells me that all the time, but no, I think, it is a myth that laboratory physicians are kind of like in the basement by themselves. We're constantly interacting with people.
Well, first of all, I think introverts can definitely have good interpersonal skills. So that part of the myth is definitely untrue.
If you go out into the lab, we have a lot of people who have fascinating backgrounds beyond what happens in their day-to-day job in the lab, and they're very much extroverts.
I guess the first thing that always comes to mind is we did have to get into medical school to get here, and we did have to go through a lot of the same rotations that our colleagues have.
What we do is we diagnose, but our diagnoses are useless unless we're able to get the message across to clinicians. So communicating our results in a way that assists clinicians to give a diagnosis to patients and to prognosticate with them, it is incredibly important. Our work is useless unless we're getting our message across effectively.
I think just because you're not on the patient-facing side of care does not mean that you're not collaborating and not discussing with other people.
They're not hiding behind a microscope or behind a machine or an instrument. They're quite extroverts, in fact, I think.